Good morning, HRC team. This is Major General Joe Calloway. First and foremost, want to say that I hope this finds you and your families healthy and well and working through these difficult times. Under normal circumstances, we'd be in Hazard Auditorium. We could get to see each other face to face. Of course, much more rewarding, and wish that was the case, but sadly for you, that is not the case. Now you are stuck with seeing Callaway's radio face in front of you. But I appreciate you taking the time to be here with us this morning. With us, and also thankful to the television studio team who gave us the technology to be able to do this and share a little time with you. Give us a little time to both provide you an update on what's going on at HRC and then some updates from our mission partners here on the installation. So with me today I have our Command Sergeant Major Lanice Thorpe-Noel, our great Garrison Commander, Colonel C.J. King, and our Ireland Army Community Clinic Commander, Colonel Hugh McLean. And I want to start off today, if I could, by recognizing those who have given a significant amount of service, and we're going to limit to those who have 40 or more years of service. So if we could start out with, for those of you that can't see the slide on the YouTube feed, I'll just tell you who those great folks are. With 40 years of service, back in 1980, when Hillary Staples, Lou Hinkle, Emmanuel Hill, Thomas Powers, Thomas Kakaris, Raymond Nelson, and Joseph Richardson started their service to the Army. The most popular song was Another One Bites the Dust by Queen. The video game Pac-Man had just come out. Yes, we had laptops, but those laptops weighed about 24 pounds each. Gas had just spiked to about $1.22 a gallon because of inflation. And I think in Elizabethtown this morning, the price that somebody told me was gas had now plummeted to 97 cents a gallon. So strange times. So thanks to that great group, 40 years of service. And for 45 years of service, back in 1975, when Tracy Clute Jr., John Heinrichs, and Glenn Walters started out their service, the most popular songs were Rhinestone Cowboy and Earth, Wind, and Fire's Shining Star. I think most of us who are my age anywhere at least owned one pair of platform shoes. We were wearing them with pride, maybe a little bell-bottom action going on. The Vietnam War was just ending. Jaws had come out, and one of the first real true blockbuster movies. Gas was 53 cents a gallon, and our great Chief of Staff, Colonel Alan Kellogg, was still in diapers. And then lastly, at 50 years of service, so just think about that for those of you just starting your careers, 50 years of service. So back in 1970, when Steve Burzloff was starting, Apollo 13 could not land on the moon. And that started, the now famous saying, Houston, we have a problem. And sadly, the problems they faced then were nothing compared to the challenge that the nation is facing and the world is facing now with the COVID-19 challenge. I think Forrest Gump was busy beating the Chinese in a game of table tennis. Sugar Sugar by the Archies, whoever the heck that is, what was the #1 song. I was in first grade in Schweinfurt, Germany, taking down people on the playground in marbles, and Command Sergeant Major Thorpe was in diapers at that time. So to Steve, a long and tremendous career of service. Steve is going to retire here at the end of this month, so we want to thank Steve again for his tremendous dedication to the Army and to the nation, and thanks to all our great employees for what you do. So we started this journey with COVID-19 just over a month ago, and really it has been a very difficult and challenging time for everybody. It's uprooted our lives, but I wanted to make sure that everybody also takes a chance to reflect. If you're watching this on YouTube, if you are an HRC employee or somebody employed by this installation, reflect on how fortunate you are. You've got a paycheck, you've got a supportive community, you've got leadership that is really committed across the installation to making sure that you are taken care of and that protective measures are put in place to make sure that not just you, but your family and the surrounding communities are taken care of. So for the HRC workforce, we've got 90% of the people who work at HRC who are currently teleworking. That's over 3,200 people who are busy doing what they do from home. We've got less than 300 people in the mod complex. And for those of us still working there, when you walk around, it's a little bit, honestly, a little bit haunting. So we're really looking forward to having you guys back. But in spite of that, the team has really come together to do all the things that you do to take care of not only readiness, but to take care of soldiers and families. So from our little things that may go unnoticed, the Health Services Division teams, both on the EP and the OP side, are not only doing their day-to-day missions, they've also reached out with our installation partners, working with the hospital and local communities to make sure that we've got the skills and the talents needed to reduce risk across our footprint. And just because we've been working remotely, I think actually the workload has increased, and it's actually increased markedly, as most of you probably realized. We've got people like Judy Powers, who has literally screened thousands of people for security clearance as part of the retiree recall effort. Quietly going about her business, doing things that have a nationwide impact. You've got Pam Williams, who is constantly helping us fight for millions and millions of dollars to make sure our IT missions continue on, and people like Toby Northern in EPMD, who from the quiet of his home office was coordinating on a very short notice the ability for a family who was overseas, who had a critically ill child, to be able to coordinate an emergency exit from this included coordination with Overseas Command, with the Air Force, and multiple other agencies to make sure that those children got back quickly and got back to Walter Reed so that they could get the treatment that they needed. That normally would have taken probably 72 to 96 hours under normal conditions, and I think with Toby's great work, they knocked that down in about 48 hours. So you don't lose sight of how important of what the little things that you're doing every day to take care of soldiers and families, not just here but around the globe. This is really the first time, I think, in history we've had a true COOP exercise to determine, can we in fact do our mission if for some reason we're forced to evacuate the mod complex. And you guys have just knocked it out of the park, and it's taken an awful lot of work from mission partners across the installation to make all that happen. So thanks for what you're doing. Again, it's been a challenge. We've had to find new ways of doing business. You found ways you figured out, how do we remote in, how do we get access to all the tools we need to do our day-to-day business, new protocols about how we conduct meetings. We're being very careful, no meetings with more than a couple people in a room, and everybody's found a way to pipe in, either using social media tools or other automation tools. You figured out how to do FaceTime and maybe house party with your family so that you can stay in touch with your extended family. Again, countless things that you guys are doing to try to overcome the changes to your life. But I'd also ask that you, while you're doing all that, take a chance to step back and reflect on what's really important in life. The small things, taking care of your family, and the simple pleasures. This is going to end, but it's important that we stay vigilant in what we're doing. If you think back when we started this, so on the 15th of March, there were less than 4,000 cases of COVID around the country, and only 69 people had perished as a result. And here we are just over a month later. So as of yesterday, we had over 46,000 deaths and over 800,000 confirmed cases. And that just reemphasizes the importance of not losing your focus on doing all the things that you need to do to take care, again, of yourself and your families. So we've taken several questions this week, throughout the week. So if I could up front, those questions really centered on a couple of themes, 5th Corps and what's going to happen with 5th Corps teleworking and what we may do in the future with telework, some issues with access on VPN, and what we're going to do about reoccupying the complex. So up front, I'd just like to make a couple comments about those topics, and then we can get to any questions that you may have from the live audience online and address those as well. So on Fifth Corps, the Fifth Corps is an Army priority, and it's an Army priority for a lot of reasons. It's a readiness priority, but remember, the Fifth Corps coming to Fort Knox is also a really great thing for Fort Knox, and it's a great thing for the surrounding communities. So Fifth Corps will continue to come. Their effective date, their initial operating capability is still planned for October, and so you can expect that that will continue as originally planned. Some of those people's arrival may shift right, 30 days or 60 days, but that will continue. So we're working the plan internal to the complex. It's a very deliberate plan on what we'll have to do to move people, HRC people who are in the mod complex, move them around. But it is literally at the name tag level of detail by person about who is going to have to come in and move to move their workstation and move their belongings to another location to make the Fifth Corps occupation possible. So if you have additional questions on that, please reach out to your directorate leadership and we'll get an answer, and more to follow as that plan is formalized. On teleworking, obviously we've done telework at a scale that's never been attempted here, actually in most places anywhere for that matter. And so a lot of the questions are we going to look at an expanded telework policy? And the answer to that is yes. So Stormy Looney and the G1 team are working a telework policy that will expand, and we realize that while some telework, you've obviously demonstrated that you can do your jobs from a remote location, there are still some losses and efficiencies. We really don't have the automation equipment to do full-scale teleworking, but we are going to expand that and allow opportunities. So more to follow that on the teleworking topic in the months ahead, but the short answer to your questions on that is yes, we'll expand it. For VPN and bandwidth, this is frustrating for all of us. It's frustrating for me and everybody working in the building because we can't get all the things done that we need to get done. It's also very frustrating for you at home who are trying to be as productive as possible and spending more of your time trying to get in. So we've taken several measures. One, if you were using social media tools or streaming video, that kind of thing on your government computer, you probably noticed that you can't do that anymore. Well, you shouldn't have been doing that in the first place on your government computer, so those capabilities have been taken down so that we're not using bandwidth to do those sorts of things, that the bandwidth can be preserved for actually work-related activities. Also we've expanded our bandwidth at the installation level, so that's gone from 1 gigabyte a second to 2 gigabytes per second. That is what normally a large installation would normally have 1 gigabyte per second. Because of what we're doing here at Fort Knox and really largely the HRC workforce, that bandwidth has been expanded as well. We've ordered what they call a concentrator to make sure that we have the most up-to-date equipment so that you can get VPN access, and the Percens D team has also done a number of things with recoding Citrix applications and trying to get efficiency. So you should have seen that improve here markedly over the last week, and you'll see additional improvement as we bring the concentrator online to give you additional access. So on reoccupying on the mod complex, there is not a timeline established to reoccupy the mod complex. That is, first and foremost, again, the concern is safety of the workforce and safety of your families and safety of the communities that we live in and serve. So that timeline will be dictated by federal authorities, by state authorities, and by General Evans as the senior mission commander. So that being said, when the reoccupation does start back into the mod complex, again, that'll be a very deliberate process to make sure we're doing everything we can to protect you. Those who are high risk are going to be the very last people to occupy the complex as a part of that plan. So there's nothing written in stone about how, when, who is going to occupy the complex, but again, a formal written plan is in the works, and we'll have that out to you shortly. I'm really very encouraged to see what we're doing as a command. We've started significant planning, not just with us, but with Army Materiel Command, Installation Management Command, and also the major commands on warm starting the PCS season. So we have about 60,000 people that typically move in a summer, and they typically move between May and September are the large months. That window is now compressed. So we're working very closely with Army senior leadership and again with mission partners that actually make that happen to ensure we do so in a deliberate process to start the PCS moves again, with the idea being that we would like to reset the force and establish readiness to the maximum extent possible, but also give predictability to soldiers and families about when they're moving. So more to follow on that as those things start to unfold. You guys gave us your telework photos, so we had about 200 folks give us their home office photos. Those were great, and I think you may have seen the award winners from that. And you've also got the HHC team is also doing a great job of reaching out and giving resiliency ideas. So again, this goes back to the idea of just because you're social distance doesn't mean you need to isolate yourself. So again, reach out, stay in contact with friends and neighbors, even if that is virtually, and then and also do the things that you need to do to take care of yourself. Get out and take a walk. Go out with your families and play. Do all the things that you would normally do. Chaplain Beganic is available for those that you may need some help in the spiritual realm. So please don't ever hesitate to reach out to him should you need that. And remember, we're all in this together. Again, it is a difficult time. We've all uprooted and changed our lives. So again, continue to stay focused and get through it. I'm also encouraged about some of the other things that are going on. You may not be tracking all this, but the great team in Reserve Personnel Management Directorate has reached out to over 800,000 individual ready reserve and retiree members to try to bring back on active duty the AMED professionals we need to help in the COVID fight. And this isn't a local issue. This is a nationwide issue. And again, we had about 27,000 folks volunteer. About 4,000 of those turned out to be medical professionals. And so we have really just started what will become a small bow wave in the number of AMED professionals that are coming on to help with the AMED fight. As I mentioned earlier, our AMED team is helping with the installation medical team to try to make sure that you're safe and get the care you need, and ensuring that the high traffic areas in the building, again, 300 people, so we don't have that much of an issue with that. All right, so I'm going to lastly take just a quick look at what we're doing in the future. So Organization Day still planned for August. We'll still plan to execute that, subject to guidance from the installation, as well as starting planning for some key events that we do every year, our holiday party and the HRC ball. These are big events that require months of planning, and we already have great HRC teammates that are lined up to help us do the things we need to do to keep the great morale and the great camaraderie that we have in HRC. So at this time, I'm going to turn it over to Command Sergeant Major Thorpe for a few comments. So thanks, and more to follow.
Good morning, HRC. How are you doing? I hope everyone is well, including your families are well. I think you will agree with me that we are operating in an environment today that is different and unlike any other environment that we have operated in. But I will tell you that I think we are doing great. You've been prompt on doing things, and you're rolling hard, and it's been recognized, and we thank you for doing that. We ask you to also know that we're going to do this together and get through this together. And with that being said, I wanted to do some friendly reminders to you about just some things that I hope that you can continue to do for us. I want us to continue to maintain good order and discipline. Make sure we stay connected by doing so with each other, making sure that we're checking on each other. Maintain strict accountability during these complex times. Meaning if you call or you have a time that your folks supposed to call in and check in with you, if they miss that time that they're supposed to check in with you, or whatever time you set up, please don't let that go unnoticed. Make sure you check on your folks and check on each other. Also ask you and remind you that you are value members of our HRC team, and you also are value members to your home team. With that being said, I want you to remember that it's important that you know General Order Number 1 is in effect across the entire installation. It has been signed and published out to everyone. Also meaning that you have to make sure you practice social distancing. Practice social distancing and wear your mask when appropriate. As we continue to build on our platform of holistic health, I want to remind you about those things available to you. Right now, the First Sergeant and the commander of our HRC command team, company command team, has published an R2 Healthy at Home program that they have already sent out for April, all the classes in April that we have. We have a couple of more left, so hopefully you'll try to participate in those classes that we have left for the month of April. We already have folks that are participating as we speak, and they are having a great time at it. So if you would, try to join us on the next couple of ones that's coming up for April. But May is coming, and we have a whole nother calendar full of classes that they have put together. So look forward to that coming out and getting published real soon. I also want to tell you about another resource. I learned about this other resource yesterday. It's with the Army Resiliency Directorate. They have a Facebook page that you can go on that talks about, have a couple of vignettes and stories that they talk about that kind of maybe be helpful to you. I actually tuned into one yesterday, and it was optimism is a skill you can learn. It was really interesting. So I encourage you to go and take a look. It's on a Facebook page. Again, it's the Army Resiliency Directorate Facebook page, and it has a lot of resiliency videos for you out there that just in case you want to take a look, it might be something that might be helpful to you to look into. As we are in this environment, we're trying to think of ways of how we could continue to be creative in what we do. So we have our leader development that we are trying to make sure we're able to continue to do. We did a Sergeant's Major's call last month, and it really had a great turnout. It actually was a teleconference, and I think it was a really good turnout with an exchange of conversation. But we want to continue to build on that by extending out to have an NCOPD, a Leader Professional Development Forum for our rest of our NCOs. And we're going to do it by grades. We're going to do it by Master Sergeants for one, then we do E7s, and then we'll do E6 and below. So look for those dates to be published. G3 is working the calendars and hashing that out for us. So we look forward to having those conversations with you and opening up those lines of communication for professional development. Lastly, before I close, I do want to take this time to kind of talk about some individuals that really went above and beyond to make an event happen. As you know, HRC FY20 Best Warrior Competition was held the first week of March. And it's a lot that goes into making those things and setting up all of those things. And we had 3 individuals that really stood out. But before I say them, I want to thank everyone that helped make all of that go well. We had over a course of a week, we had 4 days of just events, and then we had a closing award ceremony that we did, and it really turned out great, but we couldn't have done it without all those that participated in helping us get it done, and also, again, thanking our sponsors. But it was 3 individuals that kind of led the charge on this and made sure all things went well. And those 3 individuals are, and they are receiving, on behalf of the Commander General and myself, they are receiving an Impact Award at AAM. They are Master Sergeant Guerrero out of G3. She was everywhere. She did a wonderful job. And then Sergeant First Class Kelly, our PAO. You talk about being right there to capture the moment, and that also being able to give these soldiers something to remember the moment. Fantastic job. And then finally, our Sergeant First Class Lenhart out of EPMD. And as you know, last year he was the winner last year for our competition last year for the NCOs. And if you didn't remember who the winners were, let me tell you real quick. The winners were for the NCO of the year for the Best Warrior competition was Staff Sergeant Egan, and then the soldier was Specialist Castillo. So just when you see them, give them a round of applause and just let them know how well they done. I thank you for your time, and I just want you to remember, you're never alone in none of this. We are working together and rowing in the same direction together. And if you ever need anything, come on in there. Thank you again so much for what you have done to make sure that we are able to do what we do. Now I'd like to turn it over to the mic over to Colonel King.
Thanks, Sergeant. Good morning, HRC, and sir, thanks for the opportunity to come and dialogue with HRC's workforce. Really just want to provide updates on 4 general topic areas, and if there's time left over in the end and you have questions, I'm happy to answer those. The first topic area is COVID-19, which have already been touched on a little bit. Get a lot of questions in terms of the HP con level, and what I'll tell you right now is we remain at Charlie. Those of you that use Brandenburg Gate or have seen Brandenburg Gate or maybe watched the other town halls from the senior commander, you'll know that we're postured right now to elevate to Delta if the requirement comes, if conditions warrant that. But with that said, we're also working plans right now to de-escalate or retrograde back to Bravo. So again, there's no trigger to move to Delta, move to Bravo at this point that's been identified, but prudent measures are being taken to ensure that we can do so if the requirement emerges. In terms of PX and commissary, those of you that have filtered through there have seen the changes there, and really and truly, despite initial friction in the very early stage of this in terms of implementing policies, I will tell you things over there are smooth. Shipments to the commissary have actually increased. There are still some items that they're struggling to get in, but for the most part, this has actually been good for our commissary in terms of shining a light on it and trying to get the right set of goods in here to support the population. Really incredible work from the folks that work over there, not only in the PX, the commissary, but the barbers, the vendors that are over there. Those of you that use those facilities, I'd invite you to thank those people because truly they're on the front lines of this thing. As you know, masking is required in both of those facilities and social distancing is in effect, so appreciate your efforts to comply with that. In terms of Brandenburg Gate, and I'll talk that specifically for the HRC workforce, to be honest, that the outbound hours at Brandenburg Gate really exist specifically for you, given the number of folks that use that thing. Right now, as you know, at Charlie, we're closed down to outbound traffic, except for during typical hours. What I will say is that when we retrograde back to Bravo, we'll go back to normal hours and procedures there. So again, no trigger for that right now, but the move to Bravo will do that. And then finally, many questions about Old Ireland, particularly from the retiree community. Some of you may have seen data streams about what's happening there. What I'll tell you right now is we have the cleanest hospital that's slated for demolition right now. At one point, we prepared to potentially stand that back up specifically to address COVID-19 patients, either from the training population, which may or may not have been on base, or from a discus scenario. As of right now, the Army has made the decision to stand pat. So while decommissioning on that facility has paused, right now it's still scheduled for demolition. Moving on to the second topic, 5th Corps, and I'll really only echo a few of Major General Calloway's comments. I thought he covered that topic thoroughly. What I will say is this, is through an installation perspective, particularly for facilities, we acknowledge the fact that a portion of HRC is being consumed specifically for 5th Corps. Cannot thank the organization enough for the cooperation they've displayed in enabling that to happen. You know, this is not an easy move. It's not it's a very complex move, but with that said, the cooperation's been incredible throughout. Despite COVID-19 and what you would think would slow the timeline, we're largely still on schedule. The projects are happening. So again, a lot of that is the result of the excellent contractor workforce that are working those projects, but much of it is due to the flexibility of the HRC workforce in terms of being able to come in, move their stuff when there's a trigger to do so, and allow that work to continue. So thank you for that. In terms of installation services, don't get a lot of questions on this from the HRC workforce, so I'll be rather vague here, but happy to take some questions. In terms of our MPD, ID cards, DEERS, soldier readiness, and transition services are still open, although like your workforce, the majority of our folks are teleworking. What I can tell you is that we can provide telephone numbers for all that stuff. I won't take up airtime right now to provide those individually, but for the most part, all those services can still be provided. Just call for an appointment and they'll hook you up. For the transportation office, we can schedule household good moves for approved ETPs to move early and after published stop move dates right now. And we'll give you a number for that to call because I know there's been many questions about that. For an appointment, if you fit in one of those categories, it's 502-624-2037. And then finally, for MWR events and facilities and CYS services, all those services are closed right now, but again, we're postured, we're planning to reopen, so there's triggers set. In some cases, there's very short flash to bang required in order to open those facilities back up. So hopefully we'll get the opportunity to do that. Those of you that have some time on your hands, hunting, fishing, golf, all open, and encourage you to participate. And then finally, the last topic, Fort Knox news generally. Battle rhythm events that we do at the installation level, such as the Real Property Planning Board, we're trying to keep those types of events on battle rhythm. We acknowledge we can't execute face-to-face as we normally would. Therefore, we're looking to go virtual or by telephone, but we need to keep those events, do routine things routinely. We need to continue to do those things. And then finally, support the Army priorities. I'm gonna give a list real quick of things that Fort Knox has been considered for. This is not unique to COVID-19. Constantly, because of the capacity here and the flexibility of Fort Knox, Army leadership looks to Fort Knox to be able to take these types of missions on. You know, CST is something we get every year. The decision on that is set for 1 May, whether it will come in some capacity or not. The training base expansion to potentially take on a basic combat training audience is still being considered. We're always in the conversation. As you know, we hosted BCAP last year. There are other senior level opportunities that Fort Knox is being considered for. MFGI is still a thing. It's still something we're planning against. After COVID-19 is over, that will become a primary focus to prepare for that and a host of others. So again, Fort Knox, very flexible installation, ton of capacity here, so good stuff. With that, I'll turn it over to Medic.
Good morning, General Calloway, Sergeant Major Thorpe Noel, staff of HRC. Thank you for inviting me here to speak to you about the changes that are going on in MEDAC and COVID-19. I'm joined by Dr. Jim Stevens, who is off camera, who will be available to answer questions. I want to, same with, as Colonel King, I want to talk about 4 subjects. So under COVID-19, the first case of COVID-19 in Kentucky was on 6 March. And then on 25 March, the first case occurred on Fort Knox. Now, the scary characteristic about this virus is the speed of its transmission. But the enemy is easily defeated if you follow the CDC guidelines: 6 feet apart, wearing a mask, washing your hands, cleaning frequently, and if you're sick, stay at home. Why is it being transmitted so fast? It's being transmitted so fast because there is no herd immunity. Much like the flu epidemic of 1918, we have not been exposed to this virus. And so our bodies have not been able to build up defenses. But I can say, and very proudly, that the partnership between MEDAC and the Fort Knox community has yielded great results. We only have 6 cases, 6 positive COVID cases on this post. But and we believe that we have reached the peak with respect to the number of cases. But as restrictions are relaxed, we go back to church, we go back to school, to the family gatherings, there will be a second spike because there will be increased exposure. Please remain vigilant with the social distancing so that we can decrease exposure. Let's talk about what's going on inside of MEDAC, because our safety is important. I have 2 jobs. One is to ensure that I have the capability, the medical capability, to treat the Fort Knox community. To do that, I have to have a reserve force in case, actually not in case, when, because it will be when, the healthcare workers, healthcare team gets sick. How am I ensuring your safety? One, by following CDC guidelines. Very early on, for those of you who've been to the clinic, MEDAC instituted screening procedures at the front door of the clinic, looking for those who were could be COVID positive or had respiratory illnesses. Second, we opened up a respiratory clinic which is completely separate from the Ireland Clinic, and that's over at Nelson. That was opened on 6 April. So all respiratory illnesses will go over there. Any age, active duty, and their families will go over there. We also instituted 100% virtual visits. So when you call in to get an appointment, a provider will call you, talk to you, and then determine whether you need to come in to the clinic and be seen face to face. This cuts down on exposure for the provider, for the healthcare team, and for the patients. To maintain this medical capability, we've had to decrease some services. Again, with decreasing exposure in mind, whether that's physical therapy for all except those cases that truly need physical therapy, chiropractic, readiness, and also, let's talk about Binter for a minute. It says on the slide that increased the number of hours during the week. We did. But to increase the number of hours and to ensure that we had a reserve force, we had to cease Saturday operations temporarily. And then at the same time, we're also encouraging folks to sign up for the TRICARE home delivery. Yes, I understand and appreciate that there is a copay, but this will decrease folks having to come onto a post, exposing themselves to others, and so it will cut down on the disease, transmission of the disease. Both Colonel King and General Calloway have touched on VCOR. What I would just add into that is MEDAC has done very deliberate planning as far as number of healthcare staff that are needed to take care of the additional active duty and their family members. We currently have enough staff to take care of the first phase, so those that show up before 1 October, and with the providers and staff that are due to rotate in, or PCS in, to MEDAC, we'll be able to take care of the 2,500 and as well as all of the 10,500 we already have. For the future, COVID-19 will continue to exist. We must remain vigilant against this enemy. We must adhere to the CDC guidelines. Do not take the low number of cases as a sign that the enemy has been defeated. If we do that, that second wave that I talked about will be much larger than if we just continue with the procedures that we have in place. We will have increased testing at MEDAC. We have purchased 2 machines that will allow testing and resulting in the clinic. Currently, we are only able to collect the sample and then we send it out and get those results back in about 4 or 5 days. But I want to stress, CDC guidelines dictate that you should only test symptomatic individuals. In the media, you're hearing a lot about everyone should be tested, asymptomatic as well as symptomatic. That is not true. It is actually very dangerous to test asymptomatic individuals. And I'll give you an example. I'm tested. I have no symptoms. I am tested. I have a negative test. I get sick a little bit later, but my test came back negative. So I'm out at church, I'm at the commissary, I'm out in the community, quite possibly spreading COVID-19. So as of right now, we are only testing symptomatic individuals. Eventually, Ireland will return to BC operations before COVID. But that train is going to be driven by General Evans, Colonel King, and Dr. Stevens using the CDC guidelines. And if the number of cases on this base is their report card, I'd give them an A. There's been some concerns about readiness. We've had a lot of questions about this. The defense of our nation is the business that we are in. To be able to fight the enemy, the soldier must be medically ready. My team and I are focused on this, and as restrictions are relaxed, this is one of the first areas that we will open back up. Mary, back to you.
Thank you, Colonel McLean. Okay, we're going to open it up for questions from our audience. The goal will be to ask as many questions as possible during the allotted time. The first question we have is for Major General Calloway. The question is, will there be enough masks procured to give all employees working in the mod complex?
The answer to that question is yes. So, we're not going to put you back in the work environment if we can't protect you appropriately. So we've ordered additional masks to make sure that you have those available as required when you return back to the building.
Thank
Back
you,
to you,
sir.
Mary. Yeah.
Thank you, sir. We have another question that I believe would be for you as well. The question is, in addition to high employees returning later, will consideration be given to employees who have high-risk family members in the home?
Well, Mary, first of all, I hope we don't have any high employees returning, but for our high-risk folks, the answer to that is yes. So, if you are over age 50, over age 60, or you're in any risk category, like if you have compromised health, the answer to that is absolutely. If you are concerned that somebody in your chain may not be aware of a high-risk situation, please reach out and make sure they know. That includes if you have a family member in your household who may also be at high risk, be that a dependent, a child who has got some sort of illness and is compromised, or just an in-law or a parent who lives with you who may also be older. Again, reach out, make sure we know that. All that will be considered. And again, those are going to be the last folks that we return back to the complex, again, to minimize your exposure to any risk. Back to you, Mary.
Thank you, sir. Colonel King, sir, I believe you've already touched on this question, but we did receive a question about CST returning. They want to know if they're coming back.
Yeah, so the decision on cadet summer training is to be determined, and I want to be very careful. I don't want to get out in front of our senior commander, Major General John Evans, who commands U.S. Army Cadet Command on this, in terms of what I think is going to happen, because to be honest, I don't know. My understanding as of right now is that Army senior leaders are still considering whether or not to push CST here this year or not. And that when I say Army senior leaders, I'm talking at the Sec Army and CSA level. So the decision is off this installation. But they're considering it, and I believe the next decision point on that is 1 May. I don't know that will be the trigger to say yes or no, but that's the next time it will be considered. And back to you, Mary.
Thank you. The next question is for our medical team. Does HRC report COVID-19 cases and test conducted numbers to one of the Kentucky counties?
Thank you. This is Dr. James Stevens. And yes, all of our reporting does go to the local counties, whether it's Bullitt, Meade, or Hardin, whichever county that person may live in. If they're off post, it will go to their local county, even if it's Jefferson or other areas of Kentucky. If they are on post, it goes to the county in which they reside.
Thank you, Dr. Stevens. We have another medical-related question. The question is, big thanks to all of the medical personnel putting themselves in harm's way to ensure our soldiers and civilians are being taken care of. There's another question that says, the hardship is not... Stand by. Major General Calloway, sir, the next question is for you. Roughly how long are ETPs to PCS taking to process through the VCSA? I realize there isn't an exact answer, but maybe an average.
Those are actually fairly quick. So the commitment from the vice is that once those get into HQDA, he'll make that decision within 24 hours. So that, for those of you familiar with the building, that is an off-the-charts goal because things typically take a lot longer. So we've already seen these come back in the case of like emergency leave, those sorts of things, literally come back from me signing it on my desk to the vice approving it, either that day or the very next day. So the challenge with the ETPs is really not so much the vice's decision, but it's the coordination between the gaining and losing command, that both the gaining and losing command can take all the actions necessary to properly ship that person to the next location, and on the other end, that the gaining command can do all the things that they need to ensure that the soldier and or the family are protected both in transit and as they arrive at the new installation. So as that process, that process will continue to evolve because the number of ETPs as we try to move ourselves out of the stop move window, the number of ETPs will increase. But again, the commitment from Army senior leadership is to turn those very quickly. Back to you, Mary.
Sir, the next question is for you as well. To what extent is the mod complex going to be sanitized prior to employees returning, and to what extent will it be sanitized?
The answer to that is yes. So the cleaning teams, even during the period where we've had a large telework population, the cleaning teams are continue to go around every day, clean the complex. Before we reoccupy, we'll take additional measures to make sure that both the public areas and the individual workspaces are cleaned, and employees will also be given cleaning supplies as well to make sure that they feel like they are comfortable in reoccupying their workspace. Back to you, Mary.
The next question is for Dr. Stevens. With the Defense Department having released their system of moving to 4-tiered system for COVID-19 testing, how does Ireland plan to handle this program?
Thank you very much, and that's actually an excellent question. The biggest concern that we have right now comes down to supplies. So regardless of the 4-tiered system that the Department of Defense would like to use, regardless of the CDC's 3 priorities, regardless of Kentucky's priorities, what we worry about is more supplies. We have the machines, but as you may know, the entire nation is short on all sorts of swabs. So regardless of essential versus non-essential, regardless of priority 1, priority 2 personnel, our plan at this time is dependent upon our number of supplies that we can get. In the future, we hope to be able to follow the entire tiered system regardless of which department comes up with it. At this moment, I don't have a great answer for you as to how we are going to handle this because we are limited by our supplies.
The next question is for our MEDAC commander. MEDAC asked us to transfer prescriptions to Express Scripts. When will Ireland validate those to ensure no gap in prescriptions? Off Post has already done this.
Thank you for the question. Our providers and pharmacists are ready to help with the transition of those scripts to the civilian sector, or to e-scripts, excuse me, as well as to a civilian pharmacy if that is the beneficiary's choice. Back to you, Mary.
Thank you. The next question will be for General Calloway. If a soldier has a PCS report date of 1 July, if the stop move is not extended, will the soldier be allowed to start their move during the stop move window?
Unless the stop move is lifted or they have an exception to policy to move prior to that window being lifted, they will not actually be allowed to commence movement. Now, to Colonel King's earlier point, however, those individuals should be able to make household goods appointments and those sorts of things, but the actual movement would not occur till after the 1st of July. So the commitment back from the Secretary of Defense, for those of you that read his memo, is they will review this decision every 15 days to determine what the environment can and can't support. Again, just like us, the Secretary of Defense's focus is make sure you're protecting the Department of Defense and the nation by enforcing the stop move. So Again, in that, barring an ETP, in that case, you would not be allowed to move till 1 July. Back to you, Mary.
Thank you, sir. The next question is for MEDAC. Can there be a way for all prescriptions to be transferred to Express Scripts to make it more efficient for people?
This is still a beneficiary's choice. Could we blanketly move everything? Yes, we could. But I'll go back and say it again, it's still the beneficiary's choice. Some beneficiaries want to come on to Fort Knox, want to go to Ventura, because then they go to the commissary, they go to the PX, and other places. So it is still, and which goes back to the last question I had, it's the beneficiary's choice, but the providers and the pharmacists are ready to assist in that transfer. Back to you, Mary.
Thank you. The next question is for Colonel King. What will happen for dual or single parents if we are scheduled to return back to work and the daycares are not open yet?
Yeah, so good question. Let me talk about what I can talk about here, because the term you used was daycare, and I'm not going to use that term for on the installation services. I'll call that the CDC. If you're talking about off-post daycares, that's a separate thing. For the CDC, what I'll tell you is that we've got about a 4-day flash to bang. When we think we're moving back to a condition that would result in additional workforce coming on, it'll take us 4 days to turn the CDC on. And really and truly, it's ready to turn on now, but it's the food. We got to order the food, and if you order that early, it spoils that thing, things of that nature. But at the end of the day, we think that we'll see the trigger coming. We think we'll be able to order that food. So ideally, under perfect circumstances, the day that we're ready to bring most of the workforce back will be the day that the CDC turns on and is ready to receive. Back to you, Mary.
Thank you, sir. We have time for one more question. This question is for General Calloway. Sir, is it possible to develop a consolidated HRC strategic message that speaks to the efforts and initiatives working in all of the directorates in support of all COVID-19 guidance, both internal and external?
Yes. So as I mentioned earlier, there's a couple of things going on. There's the reoccupation of the mod complex. There's the Fifth Corps move. All of those are now, like it or not, related back to the COVID-19 fight. The first challenge is win the COVID-19 fight and then address all that. But those documents will be coming out formally, and we'll send those out in an HRC all. For those of you that may not have seen it, the Families First Leave Act and the impact of that, some decisions on special leave accrual, both on the military and civilian sides. We will get all those sorts of things out to the workforce in an HRC all, just to make sure you're aware of, again, what the plans are to reoccupy the mod complex, and then other things that are affecting you and your families during this time. Back to you, Mary.
Thank you, sir. I'd like to thank everyone in the audience for posing questions. If there are follow-up questions, please feel free to send those to the Public Affairs Office or to the G1 office, and we will get an answer for you. Thank you very much. Sir, I'd like to turn it back over to you for your closing comments.
Okay, thanks, Mary. First, I'd like to thank C.J. King and Hugh McLean for joining Command Sergeant Major Thorpe and I, taking their time out. They've got busy jobs as well, so guys, appreciate your time to support us. Great job as always. And then most importantly, and as well, thank the audiovisual team here for giving us the capability to connect with you and make this work. And then most importantly, to the tremendous professionals that make HRC such a great place, such a great organization and a great place to work. And an honor to be on the same team with you. I just ask that, it is a difficult time. Please make the short-term sacrifice that's necessary to make sure you're taking care of yourself, your family. At the same time, it is a unique circumstance to also try to strengthen the bonds with your family. For those of us in and out of uniform, you really don't get this much time to spend with your families, in the course of your professional career. So, it is tough, but take advantage of it. Think back to the folks in World War II. They left. They were gone for they got on a boat, they got on a plane, and they were gone. They didn't know if they were gone for a year or 3 years, and some of them were. So about 76 years ago on the 18th of April, 16 B-29s took off from an aircraft carrier in the Pacific Ocean with 5 teams each. All of those people took off on that aircraft carrier, knew that the likelihood that they would live was very, very small. They made a conscious choice to sacrifice for the country. So I think if you take the sacrifices that we're making here and the sacrifices those who lived through the Depression or that the greatest generation made in the World War II era, you know, what we're sacrificing today pales in comparison. So keep it in perspective. Try to stay safe, stay healthy. Thanks for what you're doing. Soldiers first, and we look forward to having you back in the Mod Complex. Appreciate your time, gang. Hool.